Chairperson, Dr. Martin, it's really an honor to talk in your presence. And I thank Dr. Ajay Kumar Singh, Dr. Abhishek and Abbott for it. And dear friends, we are a country of 1 billion people, and that's important. Now, the slides say it is 1,327,000,000. That's correct, but 327 million we almost forget. And it's not loose change, it makes the whole of United States population. So we have to understand the problems that we may be having here. We have 12 to 13 million people with epilepsy here in India. And out of them, 50% have active epilepsy. That makes it 6.5 million. These are the persons who either are on anti-epileptic drug or should be on anti-epileptic drug and would require regular care from a physician. Not necessarily that every such patient should be seen by a neurologist. Now, when we come to our problems, we have only about 2,000 neurologists with us, and taking care of so many patients with epilepsy is a difficult task. The prevalence of epilepsy in India, there was a study, Burns study, which is most often quoted, in the Bangalore Urban Rural Neuroepidemiological Survey, and it found that there was a prevalence rate of 8.8 per thousand population in India, but the rate in rural communities were double the rate in urban communities. And the reason for it is not very far to seek, as in India we have a significant proportion of symptomatic epilepsies which are related to birth hypoxia, which are related to head trauma, which are related to neuro infection. Now, one more thing I want to highlight, and that is stigma, prejudices, and women, and maybe human rights. I want just to highlight this. I know that I cannot take lots of time, but these are few things which I would like to say. Like when we talk about women with epilepsy, the usual issues are what kind of anti-epileptic drug we choose, and we have discussed it. Everything suggests that sodium valproate may not be a right choice for women in reproductive age because of various effects, various undesirable endocrine effects, increased incidence of malformation. But in our setup, we have certain other problems. And the problem is that of stigma and prejudices associated with women with epilepsy. It's very difficult in our setup to do a marriage negotiation if the young girl has got epilepsy, and I face it daily in my routine practice. Father comes to me and say that please write your medication for some other indication. Suppose if I have prescribed Carbamazepine for epilepsy, they would insist that I should write some other name of the illness where this medicine can be prescribed. You can understand the kind of problem that people have. All the women, the newlywed women, they have to hide their medicines, and what they do, they keep their medicines of anti-epileptic drugs in Whitman's bottle, so that nobody knows that she is taking medicine for epilepsy. Now these are the social aspect that has to be we need to come face to face with.